Okay, finally I have another abstract, which is related to the POM-DEFIL trial. This is a trial in a different patient situation, which is patients at relapse. And what we have done here is to combine pomalidomide plus dexamethasone with a novel agent called Filanesib. Filanesib is an agent that blocks the kinesin spindle proteins that are proteins required for the spindle, for the cell cycle progression of the cells. This trial is based on some preclinical data from our lab, in which we have seen that these three drugs, pomalidomide, dexamethasone, and Filanesib, combine quite well, and they have a synergistic activity in different cell lines and murine models. So we have included here 35 patients in this trial. And first we defined the MTD of the combination, which was 1.25 for Filanesib and 4 milligrams for pomalidomide. And then we have evaluated in this trial, in this abstract at ASH, we have evaluated the efficacy and the safety of this combination at the MTD. We have seen that the safety, the drug, this combination induces the main toxicity is hematological toxicity with grade 3-4 neutropenia and thrombocytopenia. In fact, as both pomalidomide and Filanesib, they induce neutropenia by themselves, it is required that to administer G-CSF prophylactic to all patients. But despite that, they had some neutropenia and some infections that were not really a concern. But I think this is something to be aware of. Also, regarding efficacy, we have a 60% partial response or better, with a clinical benefit rate around 70%, which I think is also nice for this patient population with a progression-free survival of 7 months. But what was particularly interesting is that we have evaluated the role of AAG, which is a protein that have been demonstrated to influence the activity of Filanesib, the levels of this protein in patients treated with Filanesib as single agent. So we evaluated the levels of this protein in this combination, patients treated with this combination. These are only 10 patients to date we have with this information, but it's very interesting that none of the patients with high levels of AAG responded to the combination, whereas all the patients with levels below the median of AAG have a response, partial response or minimal response. So I think this is for me the most attractive point of this trial is that it's effective, but probably we can select those patients based on the AAG levels that would respond to the combination.